This hearing is now in session and is being digitally recorded to maintain a permanent record. Again, my name is Kevin Berge, and I am the hearings officer for today's hearing. Today is July 17, 2024, and the time is 10:34 a.m. The purpose of this hearing is to provide an opportunity for public comment on the rules proposed for the amendment of Oregon Administrative Rules 813-005-0005 to add the definition of accessible unit to allow the department to develop clear policies related to accessibility. OHCS invites comments about these proposed rules and whether other options should be considered for achieving the rule's goals while reducing potential negative impacts that may derive from the rules as currently proposed. In addition to presenting oral comments at this hearing, written comments may be submitted until 5 p.m. July 22nd, 2024, which is the close of the public comment period. Please submit comments to me at kevin.berge@hcs.oregon.gov. Comments received after 5 p.m. on July 22nd, 2024 will not be reviewed or considered by OHCS unless the agency decides to extend the public comment period for everyone. OHCS will not respond to questions during this hearing. After the close of the public comment period, I will prepare a report to OHCS capturing all comments and responses. So we're ready to take comments from those in attendance. Are there any comments that people would like to offer? Please raise your hand and state your name and who you represent. Give this just a few seconds here. If there are no comments that people are willing to offer or want to make right now, we can stop the recording. Let's just give this a few minutes. If you decide you do want to make a comment, I will restart the recording so we can capture that.
Kevin, we have one. We have Matthew's hand raised.
Okay. Thank you. Matthew, go ahead.
Hi, good morning. My name is Matt Sears. I'm the Public Policy Director with the Oregon Council on Developmental Disabilities. And the reason I'm here today is because I was fairly involved with the ONA process, the Oregon Housing Needs Analysis process. And also this bill came about around the same time. And I wanted to provide some comments about the context of this bill and address some concerns as to whether this definition of accessible unit is actually meeting the legislative intent of HB 3309. So first of all, with respect to HB 3309, the purpose of this section of these rules is to clarify essentially what the Housing Stability Council is supposed to be doing. And there's two things that the Housing Stability Council has to do with respect to thinking about accessible units. One is that the Housing Stability Council is supposed to be analyzing local, state, and federal laws to see whether they increase the likelihood of production of accessible units. The other thing that the Housing Stability Council is tasked with doing is to analyze ways to incentivize the creation of more accessible units. So that's kind of boiling down what HB 3309 was trying to do in terms of the Housing Stability Council. In terms of the legislative intent of HB 3309, based on my participation in having helped draft HB 3309 and some of the legislative testimony at the time, I think it was clear that what they were trying to do was to make sure that the Housing Stability Council had in mind heightened accessibility standards. In other words, we were trying to make sure that the Housing Stability Council incentivized or try to analyze the increased production of the most accessible housing units. I say all that because as I'm reading the definition, I believe it is getting at that. The definition of accessible unit here is in line with how the Oregon Structural Specialty Code defines accessible units. It's a very short definition. Basically, all it really says is that an accessible unit is a dwelling unit or sleeping unit that complies with this code, i.e., the Oregon Structural Specialty Code, and provisions for quote unquote accessible units in ICCA 117.1. So my comment is, I want to make sure that this definition clearly is specifying that we are talking about the ICCA 117.1 standards for capital A accessible units. We're not talking about type B units. We're not talking about type A units. We're talking about capital A accessible units. Those types of units are defined under section 1102 of the ICCA 117.1. Type A units are defined under section 1103. Type B units are defined under section 1104, and that's the 2017 standards. What I'm a little bit confused by or concerned by is that this definition of accessible unit doesn't specify which section of the ICCA 117.1 standards are actually being referred to. So I think if I had to improve on this definition, it would specify that accessible unit means a dwelling unit or sleeping unit that complies with this code's references to quote unquote accessible units and provisions of accessible units in ICCA 117.1 as they are set forth in section 1102. I think it's very important to reference specifically section 1102. And a couple other just thoughts on, why is that important? Because the way that this is phrased, I think is a little bit too ambiguous and could be misinterpreted. Somebody could read this and think that an accessible unit is any unit that complies with the Oregon Structural Specialty Code. Well, a unit that would comply with the Structural Specialty Code could be a type B unit, it could be a type A unit, it could be an accessible unit. Whether it complies with the Structural Specialty Code is whether those standards are being applied in the right context. In other words, it's about that scoping requirement that the Oregon Structural Specialty Code has. So, essentially, if we're just saying that the Oregon the Housing Stability Council is analyzing whether local, state, or federal laws are ensuring that units are being built to code, well, that doesn't really do much, frankly. I don't think it's really the legislative intent of the bill. The intent of the bill was to have the Housing Stability Council ensure that the most accessible units are being built, and that's the capital A accessible units as defined under the Oregon Structural Specialty Code. OHCS references a lot of the standards from the A117.1 section 1102. And I think this is important because right now, if you read the Oregon Structural Specialty Code, it does not specify any heightened accessibility standards for single-family dwelling units or even multifamily dwelling units that they're required to build capital A accessible units. So if we're tasking the Oregon Housing Stability Council with just ensuring that new laws follow the code, we're not really going to be encouraging any new capital A accessible units in multifamily housing or in single family or middle housing, which I think was really the purpose of this HB 3309. And so I'm going to just pause there because I think I've said quite a bit, and I see a couple more hands raised. I might have some more comments to add in a moment.
Sure. Thank you for that. Alan, I think you were up next.
Thank you, Kevin. I appreciate the opportunity to talk. My name is Alan Delatorre. I'm representing the Northwest Pilot Project. We're a nonprofit in Portland, Oregon, that houses extremely low-income older adults and is addressing our homelessness kind of population here in many ways. I want to just kind of cut straight to it. I've got a little bit more elaboration that will be in the written comments next week, but we have a moment in time right now to prepare for the aging of our population. Accessible housing is needed to address that, as well as the increasing number of people with disabilities. I'm pulling these numbers directly from, or these concepts directly, sorry, the demographic trends directly from the Portland State University Population Center's report that was written to inform the ONA process, where they clearly detailed where we're going as an aging population and an increasing number of people with disabilities. In addition to that, a recent study in California, which gives us some of the best data that we have on homeless older adults, found that about a third of those homeless individuals were experiencing problems with accessible housing, right? So we are exacerbating the problem of homelessness by not allowing people to age in place or to find housing that they can live in if they have a disability. So I want to support and agree with Matt Sayre's kind of comment that it's important to hold our accessibility standards high and to not provide options for folks to decide whether they're looking at a type B unit or a capital A accessible, and highly encourage the state to consider the International Code 117.1 section 1102. It's in line with what Matt had said earlier, and I understand he's a content expert in this area, and we've had conversations around the code and agree with that position. I'll follow up with written comments next week and really appreciate the opportunity. Thank you.
Sure. Jackie, I think you were up next.
Hi, thank you so much for the opportunity to present. My name is Jackie Haddon. I'm a longtime social worker, realtor, and co-founder of Livable Homes, which provides accessible design consultation as well as an accessible home certification program that has been in existence in Southern Oregon through the Rogue Valley Council of Governments for many years. We are bringing the certification to the Portland area because of partially because of my work as a certified aging in place specialist and a realtor, understanding working with vulnerable populations through all socioeconomic levels, the difficulty and often impossibility of finding truly accessible homes for people at all financial levels. Of course, this problem is exacerbated when you look at the truly vulnerable populations in 0 to 30% AMI on up. My recommendation is to support both what Matt and Alan have said. Our certification program is based on these ICC codes, specifically at the 1102 level, section 1102 level. I find with the work we've been doing, developing partnerships with the residential construction industry as well as realtors, that there is considerable support for this at this point, much more so than there has been in the last few years. And I believe that that is because of increased understanding of what's happening with our aging population as well as our disabled population, and that those two populations, the intersectionality between those two is vast. I would very much support having this higher level and clearly defined level of accessibility, because I know builders, and builders will build what is most cost efficient. And if we cannot incentivize building to the highest level, then those are not what will be built. There's some education that still needs to be happening in our community around why accessibility, why now, and how building it truly accessible units creates opportunities for everyone, regardless of mobility levels, regardless of age. Universal design, accessible design is something that is critical for anyone to stay in their home. Further, using these design technologies, using these design concepts helps stabilize housing so that people who do live in homes that currently are not functional for their needs are able to get support from their city, region, state on up to modify those homes to stay in them. I'm aware, anyone in the construction industry is aware that remodeling to aging accessible design is the most expensive way to build. What we need to do is have these standards set at a high level and then be incentivizing those standards being incorporated while plans are being developed to truly take advantage of cost efficiency and economy of scale. So again, I'm in support what Matt and Alan are saying. I will also follow up with a written commentary, and I appreciate the opportunity to speak today.
Great. Thank you, Jackie. Michael, I think you are next.
I think you're on mute, Michael.
That always happens. I always do that. I apologize. So I'm going to start over. My name is Michael Sporluk. I am an independent consultant focusing on rights of persons with disabilities broadly. One of the areas that I've focused on in the past has been on housing. I appreciate very much both the opportunity to speak and also the words that Matt and Alan and Jackie shared already. I agree 100% with everything that has been said. I will try not to just repeat what they said. I want to just call attention to several minor points. One is that because the standards are so technical, I think it's really important for there to be an actively engaged awareness raising strategy so that everyone knows that these new standards are in place. And that and especially around the definitions. I mean, terminology, accessibility terminology is very confusing with the type A, the type B, the type C, the accessible unit, the capital A. And so we want to make sure that everyone is on the same page. And so when we're saying local jurisdiction A, B, or C is implementing or starting an accessible unit development, that means. Regarding, we also then need to have in place some robust monitoring, so we make sure that we're on track in terms of are the units being built? Are they being built to the standards that are required? Are they available for people who need them most? Are they affordable for those populations? All of those questions. I wanted to just piggyback on something that Alan said about the study in California. We also know that that homeless population are disproportionately people with disabilities. And so we need to make sure that they have and diverse disabilities. So we want to make sure that they have access not only to the units, but also to the support that they may need to thrive and to be safe. We know that, final comment, that people with disabilities, when we think about accessible units, we often only think about people who use wheelchairs. And the disability community is incredibly diverse. And I just want to make sure that we're not forgetting those other populations of people with disabilities. So for example, people who are blind, people who are deaf, people who have intellectual disabilities, making sure that they are in environments and in housing that suits all of their needs. So once again, thank you for being able to participate. And I will also be sending written comments over the next week.
Great. We have a few more minutes if anyone wants to add to what they've already said. Go ahead, Matthew.
Yeah, so I wanted to piggyback on a couple of the comments that Michael just made because it brought some other things to light. I think one of the most important things that Michael pointed out to was that concept that accessibility not just be confined to thinking about wheelchair access. And I do think that OHCS should think about whether this definition of accessible unit, even just defining it according to 1102, whether it goes far enough. Because there are other forms of housing that can offer accessibility features that aren't necessarily defined by code. For example, when thinking about the needs of people with intellectual or developmental disabilities or with behavioral health issues, accessible housing might mean supported living or access to supported living services. And so maybe that's something that the Housing Stability Council should be thinking about when they're looking at when they're considering a definition of accessible unit, whether laws, local, state, or federal laws are incentivizing or improving the creation of supported living units or supportive housing. I think, you know, the other thing to consider with respect to blindness and deafness is that there is a code out there that's not the ICC A117.1 code relating to features for those who are deaf and blind, and that's the Uniform Federal Accessibility Standards. And those come into play when there is a housing development that receives federal financial assistance, generally speaking. That's Section 504. So there's this whole other set of UFAS standards, which is often described as accessible unit plus. So it's like taking the Section 1102 standards, and it even adds a little bit more. So, you know, I think OHCS could consider redrafting this definition of accessible unit to include the OSSC, that capital A accessible unit standards, to reference the ICC A1117.1 Section 1102 standards, but also possibly add in that it could also, you know, sort of like an or definition, or it could also encompass units that comply with UFAS standards, to sort of make sure that when the Housing Stability Council is considering those as well. And I do see some other folks have hands up, and it's about 5 minutes left, so I'm going to stop there.
Right. Well, thank you, Matthew. Jackie, go ahead.
I wanted to add one thing I forgot to say, just is my recognition that part of what makes this work is the tracking, right? Is understanding what is being built, how it's being built, to what level it's being built. And while that's easier to do when you're building with ADA standards in multifamily or in commercial, it's very difficult when you're looking at single family homes and small residential communities. And to Matt's point, there are opportunities for housing that are not often considered. And that's where we are hoping with this accessible home certification to really play a large role in being able to track, to certify and track what is being built, whether that's in a cottage cluster, whether that's in a single family home that's been remodeled, whether it's in a situation where someone is remodeling their home for accessibility standards so they can participate in home share, where they can bring someone in to live with them. And I think that what's needed is that certification component, just like what's needed with energy efficiency is the LEED standard. We at Livable Homes, we're very committed not just to developing a robust certification program, which we have done, but additionally to develop a robust database so that those that quantitative and qualitative data can be managed and can be researched and dug through. Additionally, we are very much interested in taking a large role in this educational component that Michael talked about. I think it was Michael, that being able to really talk to the building community, talk to residential construction, speak to realtors about how you do this, speak to our community about what it means to have truly accessible housing, and continue to engage at a legislative and advocacy level in these conversations. So, thank you.
Thank you, Jackie. Alan, go ahead.
Thank you. It's worth considering in the PSU Pop Center report regarding ONA, the coupling of disability data that they've done as being accurate and helpful. So they combine vision and hearing under one variable. They combine cognitive and independent living under one variable, and they combine self-care and ambulatory disability under one variable. These are kind of breaking out those disability types, and it's done from a research lab at Portland State University. I can't say with any confidence that that's the right breakdown and pairing, but it is a useful kind of first step in thinking about those combined disability or disaggregated disability types. Thanks.
Great, thank you. Go ahead, Michael. You're on mute again.
Oh no. Oh no. Again, my apologies. What Alan just mentioned reminded me. It's really important for us not to only think about people with disabilities and to avoid any other consideration of their other identity markers. We know, for example, that BIPOC persons with disabilities are afforded even less access to opportunities and resources, have lower socioeconomic indicators, health indicators. And so as we are going about rolling this out, making sure that people from all sorts of diverse communities understand what is available, what incentives exist, and what opportunities are available for either making their current home more accessible or finding new accessible housing.
Great. Well, that brings us right to 11. I want to just say I really appreciate your attendance, the comments today, and I look forward to getting any written follow-up comments that may be forthcoming. So thank you again. It is now 11 a.m. and the hearing is adjourned. I will stop recording at this time and just want to thank you all again, and we'll continue the conversation. And goodbye for now.
Thank you.
Thank you.
Ken.
Bye.
Take care, everybody.